but not all patients are accessing. You know, I told you when we started that we are looking at SHA 1 year later. And when we are doing analysis of our program, we start with the positives. The positives is that the cap of the Social Health Insurance Fund of 400,000 Kenya shillings per patient is working. They're able to access 400,000 Kenya shillings. The challenge comes when the 400,000 Kenya shillings is depleted. And that's why, if you look at the media, there were no complaints between August, September, October, actually up to around April, because most of the patients were able to access the 400,000 cap. Now, the challenge came now when that cap is exhausted, when they're supposed to access the emergency chronic critical illness fund, which was increased. Again, we give government due there. They increased it to 150,000 Kenya shillings. Remember, the source of the social health insurance fund should be the contributions, by members. The source of the emergency fund is from exchequer, from grants, donations, also from Act Parliament and all that. So our only issue right now is that not all patients are able to access the 150. We are okay with 400,000. We are okay with accessing that much, but we are not okay with accessing the 150,000 Kenya shillings. And of course, in our analysis, we are giving out feedback, because at the end of the day, the National Cancer Institute, the civil society, the government, we are all working towards the betterment of the patient. And for us, we want the universal health coverage to work so that the document that is on paper is transferable. So the only one of the challenges that we have met, there are only 3. And if those 3 can be addressed, I think we will be okay. So the first one, they are saying National Health Insurance Fund was giving what we call the individual cover. So that means, O'Brien, if you are your wife, and you had the NHIF, if yours get depleted, your wife will still come and use your cover as a dependent. The difference with Social Health Insurance Fund, which is fantastic again, that the patients can access the 400,000, but once it is household-based. So it means if a household depletes the 400,000 Kenya shillings, it is all of you. So even more unto you, if there are 2 individuals in that house that have a chronic illness, it means it will be depleted faster. So we are requesting that in the analysis, it has worked in the year, but now can we go back to the drawing table and say we either go back to the individual coverage or we stretch it just a bit, because the law allows us, the policy allows. If you look at the Social Health Authority Act, it actually allows for the government to put in, because now SHA is saying they have a challenge of having the informal sector. Not everybody has dipped in. We understand, because if there is no money, how will the people be covered? We are also now appealing to everyone, all Kenyans, please get the Social Health Insurance Fund, because when you do so, you will have saved a patient, a family that is grappling cancer, not only cancer, but also chronic disease. Number 2, what they are telling us right now that is coming out very clearly is that they are not able to afford the yearly or the annual payments. It is a fantastic idea, because it will make sure that we also have, because what SHIF does, it puts all the money in a basket. So we will the more people pay per year, we will have a lot of money, and that's the universal health coverage idea that this government came up with, which worked. But now we are having a challenge because it is not enough. So if it is not enough, not everyone, especially from the informal settlements, can pay the 1 year. So we are requesting, as we review, can you go back to the policy and even do a half year? For example, 6 months. It will be better for that mama mboga to access it rather than asking them to pay 7,800. Or can you do it even 3 monthly, so that we have a better package for it. So that's why you see, when I started, I said it is working. 400,000 Kenya shillings is working, but we cannot access the 150 chronic illness. On paper, it is there. I can see it on UHC, but now we are not able to access it. So if those are added up from the exchequer, it will be a